So this is the next edition of the Ben and Gary Show. We know dentistry, and we have another question from one of our callers and subscribers that they ask about. Well, is it possible to really do teeth in a day? You know, we get that all the time. It is possible to do that. That is a typical tagline that has been used to popularize the ability to be able to have teeth in one day and done that. However, you have to understand there's a tremendous amount of pre-planning that goes into that, and it's not just teeth in a day. It might be teeth on that day, but it's not necessarily teeth in a day, walk in cold and then have teeth right walking out. That is a completely unrealistic expectation, and that is not realistic. However, this is something that has been made popular in the most recent years, and you can probably pick out some of the ads you may have seen on television as to how that might be possible, or who might be offering that. I can tell you, certainly in our office, this is something we've been doing for probably well over a couple of decades, 20 years, and it is certainly possible to be able to do that. But there needs to be some understanding as to what does that really mean. That really means that you have an interim set of teeth that would be connected directly onto multiple implants that are just strategically placed in a way in which they will support the teeth immediately. A denture is converted to be able to be placed on top of the immediately placed dental implants, and the patient is then given a full complement of teeth that goes from one side of their mouth to the next and is in a U-shaped sort of form. Now, those teeth are plastic, and they are designed to be able to give you interim teeth, but primarily it's designed to be able to tie or connect all of those dental implants together in a curve so that there is no mobility in the process while they're healing. When those are held together, much like you would if you have a bone break, you're put into a cast and made immobile, the bones, if they're approximated together, will heal together. The same concept with a dental implant made out of titanium, that if that implant is not moved and wiggled, yet there might be force on it, that implant will integrate and fuse with the bone. Now, if they're tied all together, much like fence posts are all tied together, put on a particular type of diet that is not going to put excessive forces on them, then that is possible to do. Now, you will say, what is it? Teeth in a day like that is really a solution for individuals that don't have any teeth at all, or essentially have teeth that are just not going to be used and they're going to be completely edentulated without any teeth at all, and a denture is then used to be able to convert into this form and fashion.
So Ben, when we talk about what is the starting point for this whole process? Because obviously people that come into our practice and other practices are looking for a solution, and they want to present in a aesthetic manner, and they want to be able to function, chew whatever meal they're having, steak. One famous quote is, "I want my steak tonight." So,
right. I want to bite on the ear of corn. Can I eat that? Can I bite into an apple?
Right.
Those are the typical things.
What's the starting point here? We've got to take some records. And,
we need to take some records. There's certain measurements that we need to make. We need to make some molds of your mouth. We take photographs. Right. Very importantly, we need to understand where's the bone for the dental implants.
Right.
That's done by a 3D scan of your jaw. It takes about 30 seconds. Within that period of time, we can instantly assess how much bone you have for implants. We can virtually place those implants in on a screen. We can even now design it so that you can see that along with us and design along with us and see how this is actually going to work. We can take with those pictures and actually fuse those together, superimpose them together so that you can perhaps see what you might look like in that process. That's called smile design. The technology is there to be able to meld all those together, to be able to give you a visualization, a realistic visualization of how you might look in the end. And really, honestly, it's about how you're going to feel. What people usually envision is once they see that, they envision that they're going to be normal, that they're going to have the look, how they're going to feel about themselves. They're going to have increased confidence in their social situations, and just kind of overall just feel better about themselves. That's really what this is going to be doing, so that honestly, as they go along in life, what's better than to have a meal with your family, your friends, and socialize. And if you can't feel comfortable in that situation, perhaps this is something that you need to be considering as an option for you. If you are a dental cripple and that you have gotten to sort of the end of the use of your own natural teeth and are tired of all of the problems that you're having, this is potentially a great solution for you.
It is. It's a wonderful solution, and a lot of people, once they go through this process, I mean, they couldn't be happier. They're more confident. They certainly will smile more. And talking about meals again, I'm already thinking about dinner. So, but they're always very, very happy when they're able to go out and socialize with friends and family, like you said. So
yeah, being left out is no fun.
Yeah.
You certainly don't want that. And also, one of the biggest fears that people have is that they can envision how maybe a relative, a grandparent, was putting their teeth in a glass, or it was shocking for them to see teeth, by next to them next to their grandparent, that individual on the nightstand. And as they may have fears, which may have led them to the situation where their teeth have been so damaged that they can't be restored, or it just doesn't make sense to be restored, they have held up and not gone to the dentist with the idea they have fear of dentistry, but then they also even a greater fear of having to put their teeth in a glass.
Right.
Well, this is the kind of solution that can provide the confidence that will never happen for you, that you will never be taking your teeth in and out, and that truly can happen in a day. However, with a lot of planning of a number of days in advance.
Right. So also, if they are afraid of coming to the office and having dental procedures done, there are ways that we can have the patient sedated so that they really can be put to sleep and you don't even have to worry about what's being done. And when you wake up, everything's in place.
Correct.
So it's great. It's a great option for people that do have that anxiety of coming to the dentist. So it's an option, right?
Definitely it's an option.
Yeah.
It's not for everybody, but it certainly is a viable solution. This is something that we've been doing for, like I said, several decades now, and it's a proven and tried and true solution and modality for this particular problem. Just like anything else, though, it needs to be used by the proper individuals who have the training to be able to do that, the experience, and it's nice to be able to have that, to be able to pull out of your quote-unquote bag of tricks for a patient, but use the right solution for the right situation.
Right.
Well, that's another episode of the Ben and Gary Show. We know dentistry. You can find us on Facebook at Smiles International DC, or just simply Google the Ben and Gary Show. We know dentistry, and send your questions. We love being able to answer these for you.